Hello everyone. Have you ever heard about sickle cell disease? Welcome to your own channel ADP for learning. Today we will dig deep into the topic of sickle cell disease by addressing some key questions. What is sickle cell disease? Which gene is affected in sickle cell disease? What are the symptoms and features of sickle cell disease? And how to treat and manage sickle cell disease? So without further delay, let's start with the first question. What is sickle cell disease? Sickle cell disease affects a person's red blood cells, which carry oxygen from the lungs to the rest of the body. Normally, red blood cells are round and flexible so they can fit through the narrow blood vessels. But people with sickle cell disease have many long, stiff red blood cells. Red blood cells usually live for 120 days. Sickle-shaped cells live only 10 to 20 days. According to the Centers for Disease Control and Prevention, CDC, sickle cell disease is the most common inherited blood disorder in the United States. It affects about 100,000 Americans, and about 1 out of every 12 African Americans carries the sickle cell trait. Sickle cell disease is most common among people from Africa, India, the Caribbean, the Middle East, and the Mediterranean. These areas also have malaria-carrying mosquitoes. Having some resistance to malaria would give sickle cell carriers in these places a greater chance of surviving childhood and having kids. So that leads to an important question. Which gene is affected in sickle cell disease? The affected gene in sickle cell disease is HBB, on chromosome 11. The HBB gene codes for a protein called beta-globin. People with this disorder still make beta-globin, but the shape of the protein is altered slightly. Beta-globin combines with another protein, called alpha-globin, to make a larger protein called hemoglobin. Red blood cells are packed full of hemoglobin molecules, which help them carry oxygen to all the tissues of the body. In people with sickle cell disease, beta-globin proteins stick together to form stiff fibers. Red blood cells become rigid and elongated like a crescent or a sickle used for cutting wheat. Cells are more likely to become sickle-shaped when oxygen levels are low. Sickle cell disease follows an autosomal recessive inheritance pattern. An affected child must inherit 2 non-working copies of the gene, 1 from each parent. People who have just one disease-causing gene variant are not only carriers. They also have some resistance to malaria. Malaria is a serious illness that is common in hot climates. It is caused by a parasite that is carried by infected mosquitoes. The parasite cannot live inside of cells with the sticky beta-globin. So that raises another important question. What are the symptoms and features of sickle cell disease? Symptoms vary between different people who have sickle cell disease, and also in an individual person over time. The symptoms of sickle cell disease come directly from having sickle-shaped red blood cells. The more sickle-shaped red blood cells a person has, the worse the effects. The stiff, pointy red blood cells can get caught in small blood vessels. This can cause pain and damage organs. The spleen is often affected, along with the liver, kidneys, lungs, and heart. When the spleen is damaged, the body is less able to fight infections. The sickle-shaped cells are also shorter-lived than normal. This can lead to anemia, having too few red blood cells, and less ability to carry oxygen in the blood. Because early intervention can help to ease symptoms, sickle cell disease is included in most newborn genetic screening panels. So that raises another important question. How can we manage or treat sickle cell disease? For babies and young children, antibiotics can prevent or treat infections. A folic acid supplement can help the body make more red blood cells, helping to prevent anemia. People with sickle cell disease should get plenty of rest, drink lots of water, and avoid too much physical activity. Physical stress can make it more likely for blood cells to take on a sickled shape. If symptoms become serious, blood transfusions from a healthy donor can provide healthy red blood cells. In severe cases, people with sickle cell disease can be treated with a bone marrow transplant. Bone marrow contains stem cells that give rise to red blood cells. Bone marrow stem cells are taken from a healthy donor who is a genetic match. The stem cells are then placed into the patient, where can then make a continuous supply of healthy red blood cells.
Sickle cell disease is a genetic disorder caused by mutations in the beta-globin gene that leads to faulty hemoglobin protein, called hemoglobin S. Hemoglobin S changes flexible red blood cells into rigid, sickle-shaped cells. These sickle cells can block blood flow and result in pain and organ damage. Researchers are testing ways to use genome editing technologies such as CRISPR-Cas9 for sickle cell disease. One way is to turn on the gene for fetal hemoglobin, which can help reverse sickle cell disease. Several months after birth, a molecular switch inside our bodies shuts off the gene for fetal hemoglobin and turns on the adult hemoglobin gene. In sickle cell disease, only the adult hemoglobin is mutated and makes hemoglobin S. To turn fetal hemoglobin back on, doctors first need to collect some of the special stem cells from your blood or bone marrow. These stem cells make new red blood cells. The cell's DNA can then be edited in a lab. Scientists usually use a vector to get all the genome editing ingredients inside the cells. One ingredient is a scissors-like protein. Another is a guide molecule that brings the scissors to the spot on your DNA that needs to be changed. The scissors cut the DNA, leaving a gap. In this example, the guide molecule seeks out the molecular switch gene that shuts fetal hemoglobin off. The scissors cut the DNA near the gene. The repair process disables the gene. Without the molecular switch, the cells make more fetal hemoglobin and less adult hemoglobin. These edited stem cells are returned to the body through an IV. The edited cells make healthy red blood cells.
Thank you for joining me in this amazing journey of learning. We will again meet with new innovative topics. If you have any doubts or feedback, please comment below.